This video, we are continuing with the signs of pregnancy. How will you know that somebody is pregnant? In our last video, we discussed the presumptive signs. I am embarking now on probable signs. And then we will talk positive signs. We said that the signs of pregnancy are in three groups: presumptive signs, probable signs, and positive signs. We already explained and gave examples of presumptive signs in our last video. You just go check for that video. We continue now on probable. Why are some signs of pregnancy referred to as probable signs? Probable. It is probable that this woman is pregnant. Yet, it's not confirmatory. You need to be able to go an extra mile to confirm the pregnancy. You do not rely on these signs. But what makes them different from presumptive? Why are they probable and not presumptive? They are probable because they are elicited by experts, by trained personnel, by physicians, by scientists. If, for example, number one, you send a woman to the laboratory for a laboratory test to test for pregnancy. You say, please, do PT, means pregnancy tests in the lab. You send her to the lab, whether they collect her urine and check from using strips, whether they use her blood by any means, any method, checking for human chorionic gonadotrophin in the blood. This is a probable sign if that test shows positive. Therefore, ladies and gentlemen, when you send a lady to the lab and the lady does a pregnancy test and it shows positive, it is a probable sign. It is not confirmatory yet. This is one of the reasons I would like us to understand facts. That somebody can go collect urine, collect blood, do the pregnancy test and it shows positive, and somebody can tell you, congratulations, you are pregnant. And you end up discovering that it was a disease you were carrying, or it was a problem that could even take your life, and then you thought it was a pregnancy. For example, a case of hormonal imbalance, a certain hormone like this hormones, this estrogen, this progesterone, for one reason or the other may be high in your system. When you collect your blood, it will show positive. You are not pregnant. You are incest sick. A case of a molar pregnancy. Remember, when they say molar pregnancy is a disease, a pathological pregnancy, a kind of situation where a woman's egg fertilizes with the sperm cell of her partner. Instead of forming the fetus, it forms a mole. Okay? Actually, after implantation into the decidual lining in the uterus, it is consumed into a mole and it begins to form some rounded fruit-like kind of structures that actually look like grapefruits. Rounded like that, filled with fluid, and they can be fast growing. They can multiply as fast as possible. And then the uterus tends to be growing, the womb tends to be growing faster than a normal womb. And the signs of pregnancy may even exaggerate. There may be absence of menses, there may be nausea, there may be vomiting, but the vomiting will be excessive, the weakness will be excessive. In fact, the signs of pregnancy will be exaggerated. Then they will tell you there is need for further and deeper examination, investigations, because what is developing in her womb might not be pregnancy, it might be a disease. A typical example of what we call a hydatidiform mole. Please, it is not enough to collect blood or urine and test in the lab. These hormones may be present quite all right in blood, but it's not confirmatory of a pregnancy. So please, we shall talk about positive signs for you to understand. So a pregnancy test is a probable sign. That is why we always tell people, when you do a pregnancy test, please, you are supposed to meet your experts. You are supposed to meet the well-trained personnel, because they have other investigations to do to accompany that test before they can confirm a pregnancy. We have seen ladies that have rushed into abortion, unsafe abortion, what some people call criminal abortion, means somebody begin to make an attempt to terminate the pregnancy because she doesn't want. She tells you that it's an unintended pregnancy, an unwanted pregnancy. Oh, I missed my period. When I did the test, it's positive. Some people immediately rush to somewhere, and some people in the name of health workers, surprisingly, may engage instruments in the name of trying to do a D&C, dilatation and curettage, trying to evacuate the uterus, which in some cases the woman is not pregnant. The womb might still be very empty. The womb might still be very normal size. Some may now send instrument and rupture the womb, puncture here and there, destroy the womb of the woman. Therefore, a lot is supposed to be understood. A pregnancy is supposed to be confirmed before you even think of anything about a pregnancy. These are probable signs. The test from the lab is a probable sign. Another example of probable signs, just like I said, they are probable because it is people who have studied well, technicians, experts, physicians, scientists, who have studied well before they can determine that if this sign is present, it means the woman is pregnant. It is probable that the woman is pregnant. Yes, it is not just any layman like your mother could determine presumptive signs, like any other person because of experience like can determine presumptive signs. But for probable signs, you must have trained. Even just a pregnancy test, somebody must have trained you and taught you that they can use this trick like this and test like this. If you start using it and test as a scientific process. So if they use a scientific process to come out with a method, okay, it is probable, except a positive sign is done, or something is done to determine the positive sign, which I will tell you positive sign. Let us see all the probable signs, or the very common probable signs. Since they are brought forward by experts, most of them are named after the experts. For example, Hagar's sign. For example, Osianda's sign. For example, Jack Mayer's sign. So you begin to hear some names, some signs, they name them after people. Those are the scientists that discovered that and brought forth. So they're named after them. So when they say Hagar's sign, what do we mean? It is a probable sign of pregnancy, whereby the lower segment of the uterus is softer. The lower abdominal wall is softer. When it becomes softer, you do a bimanual examination and notice that 2 fingers that go into the vagina, 2 fingers come on the abdomen, just about 2 centimeters above the symphysis pubis. You compress from inside the vagina and your fingers touch. You can feel the fingers from inside. It looks like the abdominal wall are really soft. And the scientists tell you that when you feel like that, that woman is pregnant. Yes, because with pregnancy, the levels of progesterone increase. And the progesterone is a relaxing hormone that relaxes all smooth muscles in the body. And they become softer and relaxed. So this is a probable sign. Probable because a woman could still have her lower abdomen really soft when she's not pregnant. But once pregnant, it is bound to be soft because of the presence of this pregnancy hormone. Now, you hear of Osianda's sign, okay? Osianda will tell you about discoloration. Discoloration. Yes, discoloration. You can use a speculum, send it to the vagina of the woman, open very well. You bring your light, okay, splash, touch very well. You notice that the walls are bluish. They are not very pink. They look darker. They look darkish. What we refer to as bluish discoloration. This is because the venous return is full. Okay, a lot of blood flows towards the uterus. A lot of blood flows towards the reproductive tract during pregnancy. Pregnancy attracts heavy blood flow and a lot of blood capillaries form. High vascularity. Okay, more vessels form and they are filled with blood. And so when you find blood on the veins, which are on the surface, those blood vessels you find on the surface are called veins. Okay, and they are carrying deoxygenated blood that does not have oxygen again, and that blood is returning to the heart so that the heart can send it to the lungs to be filled with oxygen. So when oxygen is not in blood, the blood looks darker. When oxygen is there, the blood is lighter and brighter. This is the reason why the blood on the veins, when you see it look darker, the veins look dark, it tells you that it is deoxygenated blood. Yes, you'll find this. You also hear of Jack Myers sign, which talks about pulsation. Pulsation. When you send your 2 fingers into the vagina of a woman who is pregnant, and then you compress anteriorly, upward, compress on the bone, upward, on the anterior wall, compress and hold there, you will feel heartbeat there. It will be beating, just like you get pulse, radial pulse, or brachial pulse. You will be surprised that you now get pulse in the vagina. That is a sign of pregnancy. That confirms that the woman is pregnant. Because if a woman is not pregnant, you cannot have pulse in the vaginal wall, on the anterior wall. These are signs of pregnancy. But they are probable because they are not confirmatory. Now, there's another sign that talks about the growing of the uterus according to age of pregnancy. If the uterus is growing in height according to the age of pregnancy, because science has proven that the uterus grows, the womb grows in height upward like this by approximately 1 centimeter per week. Meaning that you can put a pregnant woman down and measure only the fundal height, the height of the uterus. The uterus has grown up to which level? You palpate and put at the height, measure with the tape right down to the upper border of the symphysis pubis, and then you get the height in centimeters. If, for example, the uterus has grown up to 30 centimeters, it tells you that that pregnancy is approximately 30 weeks. Therefore, the height in centimeters corresponds, okay, to the age of the pregnancy in weeks. And there is a standard deviation of plus or minus 2 weeks. Meaning that what? If you measure from that height and it is 28, it means that that pregnancy is at least between 26 to 30. Meaning that the 28 in the middle, you have 2 behind, 2 ahead. If that is how a technician can work to determine the age of a woman's pregnancy, even without using a tape. How can this one go? Because understanding probable signs will let you know that once the womb has grown from the pelvic cavity upward up to it takes the level of the symphysis pubis. Symphysis pubis, that's the upper border of the pelvis, and it's about to end to come up into the abdominal cavity. When you palpate and feel that uterus only is tipped at the level of the symphysis pubis, such a pregnancy is about 12 weeks. When the pregnancy has grown onto the height of the fundus is between the umbilicus and the symphysis pubis, that pregnancy is 16 weeks. At about the same level of the umbilicus, the pregnancy is 22 weeks. You know, when it is now midway between your umbilicus, your navel, if the fundus has grown more than your navel, but it's up to the middle between navel and xiphisternum, you know, where people always feel pain of gastric, you know, where your chest wall just end up here. If the womb has grown up to the midway between umbilicus and xiphisternum, that pregnancy is 30 weeks. But if pregnancy has grown onto it's blocking you, it's at xiphisternum, you find the lady finding it difficult to breathe. During such moment, a pregnant woman seems to be so tired and weak, and then it's finding it difficult to breathe. Pregnancy, the womb has grown up onto it is interfering with the diaphragm, the covering of the chest wall. And then the diaphragm cannot expand enough for lungs to take in air and send out air. And woman begin to feel so heavy during that time. But they say if the womb has grown onto it is touching the diaphragm, that pregnancy is 36 weeks. But it's not yet at 10. Because after that, the baby will start descending, going down back into the pelvic cavity. Then the fundus, the height of the uterus now begin to drop. That's why they say at 40 weeks, if pregnancy gets to 39, 40 weeks, you want to measure the height of the uterus, it instead drops. And the woman starts breathing. The woman again during that time starts feeling fine because there's no interference with her diaphragm. She starts breathing well because the pregnancy is not compressing her diaphragm again. But she tells you that, the last few weeks I was really tired, but this week I feel better. When you feel better like that, it is a sign that labor is at hand. Labor may come in within the next 3 days, 1 week. But you see, what am I saying here? Studying the growth of the uterus according to age of the pregnancy, as we say, it grows by approximately 1 centimeter per week. Some women have the uterus growing like that, whereas it is a growth. It is fibroid, uterine fibroid. We have had cases like that with a woman's womb, and she's been coming to clinic. They keep measuring it, and she's glad that the height is increasing. But we end up proving that it is not a baby in the womb, it is growth. And that growth has steadily been growing. Therefore, even though pregnancy grows like that, it is a probable sign. It's not confirmatory. Now, ladies and gentlemen, let me now list the positive signs so that we'll end this video. What are the positive signs, the true signs that this woman is pregnant? 1, fetal heart rate. When the baby has formed in the womb, until you can listen to the fetal heart rate, whether by your peanut fetoscope or you use the Doppler or the electronic device, and they can get the fetal heartbeat, the heart has formed until it starts beating, it is true that it is a baby. There is no disease that has heartbeat. Number 2, fetal parts that are felt by the nurse, by the doctor, by the midwife, by the health professional. You put the pregnant woman down per pet, you touch the abdomen and you can feel the parts and can differentiate the head from the buttocks. The head is round, hard, movable, okay? And then the buttocks is soft. And then the arms, since they are folded to one side, the arms and legs, you touch the side, it is rough and you feel the arm. And the other side where the back of the baby is smooth but hard. Then it confirms that this is a baby growing in this woman. No disease, no fibroid can show those signs. Now, fetal movements. That's number 3. Felt by you, the technician, the nurse, the doctor, the midwife, the expert. Okay? If you touch the abdomen of the woman and the baby kick your hand, that is movement, that you have felt that the baby inside there is moving. Not what the woman reported. Because the woman may be hallucinating. The woman may be telling you, no, yeah, picking the work of my belly. When it's a psychological thing, you should touch and feel. Is the baby moving? Does the baby make movement? Number 4, you can go for an ultrasonography. You can do what they commonly call echography. Go and do the scan, and they can visualize and determine a lot about the baby in your womb. And that will confirm whether it is a baby growing in your womb or something else. There, I will say, my name is Dr. David Ayim. I am your reproductive health expert. If it is your first time joining us, please subscribe, like, share. But you can comment, please. You can ask questions. This is more scientific lessons that we can worry about and share and do more research and grow our knowledge. Thank you. Thank you.